I'm Seneca Gaden. I'm a 214 nursing student, and today I'm going to show you how to do a life port access along with a dressing change. So first off, I would check my doctor's order, make sure everything was okay. I would have already washed my hands, come in, introduce myself to the patient, describe the procedure that's going on, and ask him if he has any allergies. I would don on clean gloves. And I would palpate his life port access, and I would make sure that there is no edema, swelling, tenderness, or pain. Everything's good. Okay, and here I have my dressing change tray. I have a Huber needle, I have a bio patch, and I also have a 10 milliliter syringe, and also a 22 to 18 gauge needle. So first off, I would place a mask on my patient. I would tell him that this is a sterile procedure, and if he can tolerate it, go. Okay. And I would go ahead and use my alcohol wipe. And I would sterilize the top of my normal saline for 15 seconds. I would remove my sterile gloves. Remove my mask. I would go ahead and put my items into my sterile field, opening away from me. Donning on my sterile gloves, I pinch the cuff and I would grasp underneath this cuff, watching where my fingers are at all times. Now put that in the trash. Okay. Now I would put the needle on my 10 milliliter syringe.
Thank you so much.
Aspirate 10 milliliters of air. And flip the bottle up. And withdraw 10 milliliters of normal saline. Making sure to get all bubbles out. cap, I only touch the rubber part. And I recap my needle. And I put it in my sharps box. Now, I uncap my Huber needle. And I pop the wings of my chlorhexidine wipe. And I do this for 60 to 90 seconds. Side and side, up and down. Okay. And while that's drying, I'm going to prime my Huber needle. Okay. Reclamp it. Okay, and now my chlorhexidine has dried. I'm going to remove the cap over my Huber needle. And I'm going to insert it at a 90-degree angle. Let the patient know he's going to feel a stick. I unclamp my Huber, I unclamp, I aspirate for blood. I do have blood return. I'm going to push the 10 milliliters of normal saline. I'm going to clamp. And without laying down my syringe, I'm going to grab my bio patch, place it underneath, going to grab my oocyte, making sure my clamp is not underneath it. I'm going to lay it down. And before I lay down my syringe, I'm going to make sure all four corners are covered, and they are. I'm going to unscrew my syringe, and I'm going to replace the cap. And I'm also going to put a sticker on top of the oocyte stating my initials, date, and time. And that's how you do a access of a life port. If I were to come in and have an order for a dressing change, I would have my dressing change kit. I would verify my order. I would state the patient's name and patient identifiers. Then I would use clean gloves. I would remove the oocyte. I would assess for edema, swelling, tenderness, or any pain. And then I would use the chlorhexidine scrub, and I would use friction, and I would do that for 60 to 90 seconds. And then after that would dry, I would replace an oocyte on top with my initials, date, and time. And whenever I documented, I would say that I used sterile sterile technique, the site and how it looked, if there was any drainage, things like that. And that's another thing. I would assess the drainage, the patch that I did take off, I would assess that for drainage, and I would also chart that in my notes as well.